My name is Ikon, and I'm a fourth-year pharmacy student. I'm originally from Nigeria, and I'm the president and the co-founder of Ikon Health Foundation. Ikon Health Foundation is a non-profit, health-focused organization. One of the things we do is we try to improve health education, increase access to health services, the underserved and low-income patient population nationally and also overseas in Africa. When we're looking at doctors, healthcare professionals in general, less than 5% of doctors in America are Black. Switch that to pharmacy. That percentage is between 6 to 7 to 8%. It hovers around that areas. With the medical history centered around African Americans and just Black people in general, that connection and the trust is not there between us as Black and brown community and healthcare providers. So the reason why I started this foundation is just being in healthcare. I saw how much my presence alone, when I'm on rotations, can impact a patient. One of the biggest things I've realized is lack of mentorship. When you are setting out on a path that no one in your family or someone you know has been through, it's very hard. A lot of people start off saying, I want to be a doctor, I want to be a pharmacist. But when you've had nobody in your family, no friends, no relative, that has ever taken that path, and then on top of that, you have to add in most people that come from Black and brown communities undergo so many traumatic factors in our society. So you see, with all these barriers, like after some time, you might realize maybe this is not for me. There's a reason why my dad didn't do this. There's a reason why no one in my family has done this. Everything comes down to mentoring. We have to find a way. We can't put all the blame and onus on institutions. We also have to do things within our community. Us that are in the field have to always look back and be like, reach out to those coming in and pull them along and be like, hey, we have to do things on our own. We have to assist the way we can, because if you want to go fast, you go alone. But if you want to go far, if you want the whole community to come with you to improve this, you have to go together. So one thing that actually drove me to start my nonprofit organization was I've always wanted to give back to the African communities. And while I was in college, I worked a lot with the refugee community through the USCRI, and I've seen and being in school and my high school was Lincoln West, predominantly bilingual, mostly refugee and Latino students population. I saw the struggle of what it is like being a refugee. I know the day-to-day struggles of emotional, mentally being in a different country, being in a place where you feel alone, or being taken out of where you are. So one of the reasons I started this foundation from a health perspective is because I'm going to be a health specialist. I wanted to find something that I am competent in to give back to the community.